4 months during the first 3 phases of Restore Illinois, Central Illinoisans tuned in for our live broadcast of the Peoria City County Health Department's daily COVID-19 briefings. Public Health Administrator Monica Hendrickson became a figurehead for understanding how the pandemic is affecting our area. She joins us now via Zoom to discuss how we are faring as a community and what best steps we can take to reduce transmissions. Thank you so much for being with us, and thank you for your endless hours in service to our community. How are you these days?
I'm doing good, and yourself?
Very well, thank you. So how is our region faring during the pandemic? Our number of cases still is hovering around 600 with 39 deaths and more than almost 140,000 statewide.
I think overall our community has done well in taking on those measures such as staying home, practicing the social distancing and the face coverings. That has put us in the position we are today, which is as a region and actually as an entire state moving forward to the next phase.
So what is the importance of testing now? Should people still be looking to get tested for COVID-19? Should they be looking to get an antibody test to see if they've already been exposed?
I think the most important type of testing is really that PCR testing that we've been advocating for. And it's really still important to do because it lets us understand what a person's status is. Many people have very mild symptoms, almost to the point of being asymptomatic. And we know that this virus can transmit in those early phases where you might have very mild to no symptoms and yet still be able to transmit the virus. So really advocate if you are in any type of gatherings or in different locations where you might be exposed, because remember, the virus spreads person to person. Take advantage of the numerous test sites that we have throughout our community.
And those gatherings will be more prevalent now that we're entering phase 4. There's a difference of opinion in the community about the seriousness of COVID-19. There are some who are really worried and want to be out but are fearful of getting a transmission. And then there are others who believe that it's not that serious and most people are going to survive. Any recommendations as to how those two groups can have the conversations about maintaining distance and wearing a mask? Because I've seen lots of people still sticking out the hand for the handshake and throwing their arms around people they haven't seen in a long time.
Well, I think both of those spectrums of conversations are actually appropriate and true. Most people who get impacted by this virus will have mild symptoms and be able to self-isolate at home and recover without necessarily going to a hospital setting. However, we know that there are individuals that are highly vulnerable, individuals over a certain age group or have comorbidities, that getting this virus will really impact their health and increases their likelihood for severity as well as mortality. And so really the discussion is understanding that no one's ever been exposed to this virus. So it's new to all of us. Our bodies need to be able to respond appropriately. And we can't guarantee that you will have a mild symptom or the person that you're interacting with will have mild symptoms. And so it's really an ability to err on the side of caution. Part of the success we've seen in Illinois has now become, I think, where a lot of people have the frustration. We've never said that the goal was no one get the virus. We've always said that we wanted to keep transmission rate or how the virus spreads from person to person low. That way the capacity on our hospital systems as well as the capacity on our public health system remains controllable. And so with that, we've actually wanted to draw out this virus and our response to it as long as possible so that we can build time, because time has been our friend. And so while we've been successful keeping our transmission rates low, our positivity rates low, and number of cases just increasing slightly, at the same time, it does lead to frustration to a lot of people, and we understand that. But recognizing the work that you guys have been doing has really been putting us to a place where we can start having those discussions about reopening safely.
I hope that we can. Monica, thank you so much for being with us. And again, thank you for your service to our community. You will find this interview and more information on COVID-19 on our website, ciproud.com.